mess up. She said you can
Knock, knock.
Come in.
I'm checking for isolation precautions and there are none. Hi, I'm Grace. I'll be your nurse today. I'm going to go ahead and write my name and the date on the board just in case you forget. Today is October 30th, the day before Halloween. Alright.
I don't need my cup out. Okay.
You ready?
Yeah.
Can you go ahead and verify your name and date of birth for me?
Yep. Lucinda Current, 3/14/2000.
Okay, let me go ahead and check your armband. Awesome. I'm gonna go ahead and double check your chart. Did you have any allergies?
Nope.
And
so today I'm just
what
gonna
brings
do
you
a
in
couple
today?
assessments on you.
Just general checkup.
But first
Okay.
I'm gonna start with
So I'm
taking
gonna be
your vital
doing
signs. So I would take
pretty much
the
a
patient's blood
full
pressure,
body
temperature,
inspection. I'm gonna be
heart
checking
rate,
your hair,
respiratory rate,
skin and nails,
yeah.
your
This is
face,
what was the
eyes,
mannequin.
ears,
But
nose,
okay,
throat.
so moving on.
I'm gonna be listening to
going
your
from head
lung
to toe,
sounds
I'm
and
gonna
checking out your
start
chest
with
and listening to your heart sounds.
the HEENT
and I'm also
assessment. So
gonna
I'm just gonna start by looking at their hair,
look at
looking at the distribution, quantity, color,
your
everything
abdomen
looks good.
just to make sure everything's going good down there. So I'm gonna first start off by taking vital
Nose
signs.
is midline, eyes are both
So let me get a temperature.
Oh,
I'm gonna start by taking your temperature.
Then going to
you go
your
ahead and
eyes,
open your
their
mouth
hair
for
on
me?
their eyelashes and eyebrows is evenly distributed. I'd be looking at their
Go ahead and close
pupils,
your mouth.
their cornea, sclera, all of that. I'm going to be testing their visual acuity, their corneal light reflex, the peripheral vision.
Alright, 98.3, that is within normal range.
Cardinal fields of
So
gaze,
next
all
I'm gonna be
that.
taking
Then moving
your
down to the
pulse.
nose, I'm going to
So go ahead
palpate their
and
nose, looking for any signs of
First, I'm gonna set a
deformities
timer.
or crevices. No, not crevices. I'm also going to have them test their olfactory nerve by covering their nostrils. And then I'm going to move down to the mouth. I'm just going to take my pen light and I'll be looking inside their buccal mucosa and their teeth, tongue, looking at all of that. Making sure that color's good, there's no open wounds or lesions. I'm going to have them open their tongue, or stick out their tongue, move it side to side. And then go into their ears. I'm going to test their hearing on either side. I'm going to be looking at the outside of the ears, inspecting their inner ear canal. And then I'm going to move down to their neck. So I'm going to be looking at the symmetry of their neck.
Awesome. So your pulse was 60 and your respirations were 14, but I did not tell the patient I was taking respirations. So next I'm going to move on to pulse ox.
I'm just going to be looking at the patient's chest and arms, again looking at their integument, making sure there's no scarring, discoloration, signs of open lesions, rashes, or wounds. I'm also going to be palpating as I go on the chest.
So your pulse ox was
signs of
98, so
trauma or
that's within
deformities.
normal range. I'm going to go ahead and get my
Testing
blood pressure
the
cuff and
texture
take your
of
blood
1 to 2
pressure.
seconds. And then also looking at signs of cyanosis and bluing in the face and hands. So everything looks good there. Now I'm going to be doing the respiratory assessment. So I'm going to start by palpating the
My left.
one sound. So let's start up.
Oh.
Clavicle. And then to the side. And go down in this pattern. On each side.
Oh, is that tight? Is
No,
that good?
no, you're good.
Okay.
So, and then I would also do that on the posterior side of the patient. And then I'm going to be feeling their chest and having them breathe in so I can look at their chest expansion. Again, making sure that it's symmetrical on either side. Moving along. I'm just looking also at their breathing, their accessory muscles, that they're not overusing them, that they have a good rate and rhythm and depth of their breathing, which everything looks good there. Now I'm going to be doing an abdominal assessment. So first I'm going to auscultate the first, or the 4 quadrants of the abdomen. So pull down the gown, first quadrant, moving above, this side, and down. And then I can also auscultate the aorta right above. The umbilicus, yeah, right here.
awesome. So your blood pressure was 115/65, so that is within normal range. I'm gonna go ahead and set this down. Okay, so now I'm gonna start my assessment. So I'm gonna be looking at your hair. Alright, so when looking at her hair, it's nice and full and thick. The color is really even. There's no lesions or like inflammation or anything on the scalp. There doesn't appear to be any lice or nits or any infestations, so that looks really good. You can go ahead.
Sorry.
There you go. Okay, and I'm also going to look at her eyebrows and eyelashes, so they're nice and full. They run the span of her eyes. Her eyelashes are nice and curved and even. I'm going to look at her face now. So her face, the color is nice and even.
Going back up to the chest.
Her face is symmetrical. There's no like inflammation, swelling, rashes, lesions, bruises, anything like that. So it looks really good. So can you go ahead and close your eyes for me and take off your glasses?
And then moving to the palm.
Okay, and then I'm gonna touch your face in different areas. Will you let me know when you feel it? Okay.
Yep.
And then the tricuspid.
Yep.
Okay, awesome. So then, can you go ahead and smile for me? Frown. Puff out your cheeks.
Then, so before I
Raise your
I
eyebrows.
make sure that the patient
Okay,
has
awesome.
their
You can go ahead and put your glasses back on.
both of their bedside reels
So now I'm gonna look at her eyes.
in the lowest position.
So can you close your eyes for me?
Again.
Okay, her eyelids are nice and symmetrical. There's no weird drainage, redness, lesions, anything like that. Her sclera is nice and white. I'm gonna go ahead and actually say everything else. I'm so sorry.
And I was trying to.
Her conjunctiva is nice and pink.
That
looks really good.
we're doing today.
So now,
The only thing
my
that
pen
I
light.
included and it's just
Thank you.
to check on
So now I'm gonna test her pupils.
Cardiac, but then I.
So first I'm gonna see, like measure the diameter.
I mean, for the
So
video,
they
I think
appear to be 4 millimeters. So that's within normal range. That's really good. So now I'm gonna check and see if her pupils are accommodating to light. Okay. Awesome. So that's really good. Her pupils constricted when I shine the light in them and then dilated when I took it away. So I'm gonna go ahead and look at them. Perfect. So there's a sparkle on both the eyes. Her pupils are nice and symmetrical. So now I'm gonna check for accommodations, or not accommodations, sorry. I'm gonna check her peripheral vision. So can you go ahead and cover an eye for me?
Which one?
It doesn't matter.
Okay.
Okay, and will you let me know when you see my fingers and what number I'm holding up?
2.
Yes. And then cover your other.
2.
Okay, cool. Then go ahead and focus on the tip of my pen real quick.
Should I look?
Okay, awesome. Her pupils responded normally. And they are round, equal in size, reactive to light, and accommodating. So that's really awesome. Next I'm going to check your 6 cardinal fields of gaze. So go ahead and focus on my pen here.
you know, like,
Okay, yeah. Okay.
so you could do that, whichever thing you feel better about.
Do you care if I take his pulse? Would you like? No.
Awesome. And then if I had a Snellen chart, I would use that. But since I don't have one today, I'm not going to be testing that. So next, you can go ahead and put your glasses back on.
Awesome.
Actually, I'm going to go ahead and palpate.
You're good.
Okay, so her nose is nice and midline. Doesn't appear to be any swelling. Will you let me know if anything hurts? Nope. Okay, okay. Awesome. And then and nothing hurts on your face. Okay.
Making sure they have a nice weight for them.
So now I'm gonna look inside her nose. Awesome. Her septum is nice and midline. There's no inflammation, swelling, redness, nothing like that. So it's really good. Can you go ahead and close one of your nostrils and breathe in for me?
And then I'm also
Okay.
going to
And the other one?
also take the
Awesome. Everything looks really good so far. I'm gonna check your ears now. So when inspecting the outside of her ear, there's no redness, lesions, anything like that. I'm gonna go ahead and palpate. Does any of that hurt? Nope. Okay. Why is that sore? I'm gonna go ahead and palpate the other side. Make sure to get the pin of the earlobe and the tragus. And I'm gonna go ahead and look inside the ear canal. Awesome. No drainage, swelling, lesions, anything like that. Everything looks really normal. So I'm gonna check the other side now. Perfect. And then, can you go ahead and close your eyes for me? So now I'm gonna test her hearing. Will you let me know when you hear this and what side you hear it on?
This one.
Okay.
Both.
Awesome. Okay. So everything with her ears looks good. So now, can you go ahead and open your mouth for me? I'm gonna go ahead. Her lips are nice and pink, not chapped, no lesions or anything like that.
So do you want me to bring up anything besides the
Let's see. Her buccal mucosa looks really good. There's no lesions, no swelling, no redness.
abdominal?
Mostly abdominal.
You got like that. Her teeth
Other
look
than
really
that, we have
nice.
Respiratory, integument,
No
and
cavities or anything.
HEENT.
Her gums are nice and pink.
What?
No swelling, lesions, anything like that. Can you go ahead and lift up? Her soft and hard palate look really good. Her tongue is nice and vascular, nice and pink and moist.
We have hand hygiene
Can you go ahead and stick out your tongue for
I don't
me?
know if you want to count that or not.
Move it side to side.
Then we have pain,
Lift up your tongue. Okay. Can you stick out your tongue and say ah?
integument,
Okay. Perfect. Your uvula moved. And then go ahead and swallow for me. Perfect.
HEENT.
So everything with your mouth looks really good.
Mhm.
So next I'm gonna move on
Respiratory.
to your neck. So I'm just gonna feel around real quick. And when inspecting
Cardiac.
it, there doesn't appear to be anything abnormal about her neck, no swelling,
Abdomen.
lesions, bruises, inflammation, anything like that. So does any of this hurt?
Nope.
Perfect. Her trachea is nice and midline. There's, like I said, no
You can
swelling
do
or
each other
anything.
if you want, just to make
Um,
it easier.
So can you go ahead and touch your chin to your chest and move your head side to side?
Feel like pretty confident.
Perfect. Can you go ahead and put resistance?
Pain.
There we go. Push against resistance and then shrug your shoulders for me. Awesome.
Onset, location, distribution.
Okay.
Yeah.
So now I'm gonna move down to like her arms and her chest area. So when inspecting her arms, the color is nice and even. Her temperature is nice and warm. There doesn't appear to be any lesions, bruises, swelling, anything like that. Moving down to her hands, everything looks good there. So now I'm gonna do capillary refill on both hands. Perfect. That was under 3 seconds. Her nails are nice and groomed.
Onset, location,
No ragged edges.
duration,
The color is
character,
nice and pink. No clubbing. So that's really good.
alleviating
And then when looking at her like lips,
Oh, radiation.
fingers, everything like that, there doesn't appear to be any cyanosis or pallor, so that's really good. So now what I'm gonna do.
Okay.
Also there's no edema on her arms. So next I'm going to have you like move your arms. Okay, perfect. So they're nice and symmetrical, everything like that. Then can you go ahead and close your eyes? And let me know when you feel this.
I'm going ahead and filling up the stuff.
Because we can just like lay that right there.
Yep.
Scroll through.
Okay.
it.
So
Yeah,
now
that's
I'm
what
gonna
I
move
do,
to
like,
her
I have it with
chest.
me and I just,
So for the sake of the video, I'm not gonna have her take off her shirt, because we're preserving modesty here. So when looking at the little exposed skin that I see, there's no lesions, bruises, or swelling. Everything looks really good. Now I'm gonna palpate. Does any of that hurt?
Nope.
No? Okay, cool. So then I'm gonna do respiratory expansion. So I'm gonna do that on your back, but first I'm gonna palpate the back of your chest. Any of that hurt?
Nope.
Awesome. And I don't feel any crepitus or deformities, so that's really good.
That's not that
Would you like me just to get up?
Yeah, can you
Okay.
stand up for me? Okay. You go ahead and breathe in. Awesome. It's really good. My fingers move when you breathe in, so that's really good. Alright, so now I'm gonna listen to your lung sounds. So there's 10 places that I'm gonna be listening for, and again, I'm gonna do this over her shirt. Normally I would have her remove her shirt and put on a gown, but for the sake of the video, I'm not gonna do that.
Okay, so HEENT.
So some of the sounds may be a little distorted. So every time I touch a stethoscope to your skin, just go ahead and breathe in for me.
So, I've got it like all pulled up. Do you want me to go first or you go first?
Do you want to go first? I feel like you know more.
If you want me to, I don't care. I'll do it. Whatever. It's gonna be the longest video ever. So do you want to pull up a chair or do you want to sit on the edge of the bed or?
I'll see you later.
Okay. Okay.
Okay, awesome. Your lungs sounded really good, considering the circumstance of the shirt being a barrier. There was no crackles, rhonchi, no abnormal sounds. So it's really good. So now I'm going to listen to your heart.
Okay.
So I'm going to listen to 5 places. So on the right, sternal border, I'm going to listen to her aortic valve. On the left sternal border and her second intercostal space, I'm going to listen to her pulmonic valve. And the aortic valve's in the second intercostal space. And then I'm going to listen to
I don't want to go back to my.
her Erb's point, which is in the third intercostal space on the left sternal border. I'm also going to listen to her tricuspid valve, which is in the fourth intercostal space in the left sternal border. And then I'm also going to listen to her
Oh my God! When did you
mitral
get
valve,
this?
which is in the fifth intercostal space on the left sternal border, or on the midclavicular.
It's
I'm
IU
sorry.
too. Like it's perfect size. That's awesome.
And that is also
Okay,
where I'm going to
thank
listen
you
to her
very much.
apical pulse
I
for
will
a
check that
minute, just to check and make sure her heart sounds are normal. And when listening to her lung sounds, her rate and depth of breathing is really normal. She's not labored when she's breathing. Everything sounds really good. So I'm going to do your apical pulse first.
I'm sorry.
And then I'm going to listen to your 5 valves, or your 5 heart sounds.
Yes.
Okay.
You can go ahead and go under.
Yeah.
Maybe like
Okay.
No big deal.
do it like this.
I'm just not gonna do it as intense as the check off. Like I'm just gonna wing it.
Dope.
Honestly, I'm mostly gonna wing everything. So I'm gonna like put this behind you. Hold on to that for me. Sorry, the mannequin, not you. Sorry. Okay.
Okay, perfect. So your apical pulse was 62 beats per minute. And again, it was normal. No abnormal sounds in that area. I heard S1 and S2. There is no murmurs, anything like that. And that was also the mitral valve area. So, yes. So now I'm going to move on to the other 4.
Okay, now we're going. Okay. Hi, I'm Lindsay. I'm gonna be your nurse today.
Hi.
Okay, nice to meet you.
Nice to meet you.
Okay, so my general inspection of the patient is
Go ahead
she
and
looks
go up your
alert,
shirt.
oriented, mood is good, she's dressed appropriately, she's making eye contact, answering my questions correctly.
Perfect. So everything
Germans
sounded
just
really
look
normal.
everywhere.
I heard
Um,
S1 and S2 on every area
Okay.
that I listened to.
So I'm going to go
There's
ahead
no murmurs or
and,
anything. Everything sounds really normal. I'm gonna check your pulses really quick. So I'm gonna do each of your carotids, each of your brachials, each of your radials, each of your dorsal pedis. But that requires a Doppler, and I do not have that. So if I did have a Doppler, I would do her dorsal pedis one because you cannot just palpate that normally. And your posterior tibialis is okay. So I'm gonna start with your carotids. Okay. Perfect. So those are symmetrical. They're both really strong. They're pumping. Okay. So now I'm gonna do your brachial. So those were symmetrical as well. Again, strong. There's no like weird pattern, like it was all even and like sounded really good or felt nice. Perfect. Again, her radial pulses were nice and even. So I'll go down to your posterior tibialis. Okay, perfect. So those were all good. All your pulses looked really good. Okay, so next I'm gonna look at your legs and your feet. So for the sake of this video, I'm not gonna have her take off her pants to preserve modesty. So I'm gonna look at her lower legs.
I generally don't.
Alright,
Just
the
because,
color's
like-
really even.
It's the video.
It's warm to the touch
Oh, thank
on
you.
both
My mom got
sides.
it
So
at
that's really
work.
good. There's
I
no
don't know what
edema
type it is.
present. Can you go ahead and move your legs for me?
Yeah,
Awesome.
it
So
doesn't
that's
smell
nice
like
and
harsh and nasty.
symmetrical. So
There's so
at
much
this point, I would
inside
also
the
check
room,
her
okay.
capillary refill on her toes, but I'm not going to have her remove her
Okay.
shoes and socks. But I would be doing that at this point. So
Yeah,
yeah,
I'm gonna be
everything
sad when
looks
it's
really
out.
good. So now I'm going to move on to your abdomen.
Okay.
So for the sake of this video, I'm going to have her turn towards me and I'm going to look at her abdomen. Okay.
God,
Looks
last
really
time.
good.
Okay.
Everything looks really good. Her belly is nice and round. Normally
Hi,
I would
I'm
have her
Lindsay.
in
I'll
a
be your nurse
supine
today.
position,
Hi.
but
Nice
there's
to
a mannequin
meet
in the
you.
bed.
Okay. So
Her
the
belly's
general
nice
section
and
of the
round.
patient
The
is
color
she's alert,
is
oriented, making eye contact,
normal.
dressed appropriately for the occasion.
She's nice and warm. So I'm gonna go ahead and palpate now, or actually
Does
I'm
not
gonna
appear to be in
listen
any
to
mental
bowel sounds.
distress. She looks pretty good.
And again, I'm
Normal.
gonna have her facing away from
Okay,
me, but I will
so
be
I'm gonna
listening
go
in the
ahead
4
and start off by
quadrants. So
taking
her
your pulse,
right
if that's okay.
lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Just to listen for bowel sounds, and I'm also gonna listen to her aorta. So I'm gonna do that really quick before palpating. Okay, perfect. Everything sounds really normal. You're not hyperactive or anything. So now I'm gonna palpate, and will you let me know if anything like hurts or if you feel uncomfortable? Okay, so now I'm gonna move on to deep palpation, just to feel your organs. Did any of that hurt?
No.
Okay, you feel really normal. There's no edema or swelling, so that's really good.
Okay, so I got a pulse of
So,
80 and a respiratory rate of
awesome.
16. So
Everything
that's
looks
perfectly
really normal.
I'm gonna go back here and
Doesn't appear to be
go ahead
any
and
anything wrong with you. And during this whole time, I was doing a general inspection of my patient, so she is alert, awake, and oriented. Her conversation is logical. Her mood
Pulse
seems
ox is
appropriate.
98,
Does
very
not
good.
seem to be in any distress. So overall, she's really good. And she does not appear to be in any pain. So I'm gonna go ahead and do some patient safety now because I'm about to leave. So I'm gonna go ahead and put up the bed rails. Awesome. The bed is in the lowest position. Your call button is right here if you need me. If she was a fall risk, I'd put on the bed alarm. She does not appear to be a fall risk though. Bed is in the lowest position. The bed is locked, so that's really good. There's no obstructions on the floor. All right. I'm gonna go ahead and talk to your doctor. I didn't find anything abnormal. You look really good. So if you need anything, just press that call button. And did you need anything before I left?
Nope.
All right. I will be back soon to check on you.
Okay.